If you're frequently tired, if you've got problems with weight gain, the problem might be a low thyroid problem, but treating the symptoms might be missing the real problem. Dr. Joshua Redd is a chiropractic physician and endocrine specialist who treats people around the nation who suffer from thyroid problems. What are some symptoms if someone thinks they might be suffering from low thyroid?
The big ones are fatigue, inability to lose weight, depression. Some of these patients gain weight rapidly. Kind of anxiety, insomnia, restlessness, things like that. So
things that might be common. People might just think they're normal, but they really could be part of a bigger problem.
Without any question.
What is the #1 cause? What makes someone have a low thyroid?
The #1 cause is a disease called Hashimoto's disease. And this is an autoimmune disease that attacks the thyroid. So it's not even a thyroid problem at all. It's actually an autoimmune disease that's attacking the thyroid.
And the thyroid is located like in your throat?
Right, yeah, right in the throat area, you betcha.
And Hashimoto's, what does that do then to you?
So what happens is it causes a lot of inflammation in the body, but also your body creates these antibodies that start destroying the tissue of the thyroid at a rapid pace, and this causes a lot of different symptoms. And this is a big issue here because a lot of these patients, they'll go to the doctor and they'll get on a thyroid hormone, but that's it, and nothing's being done to the actual autoimmune disease. And in this case, the autoimmune disease would flare up, destroy tissue at a rapid pace, and these patients feel little to no improvement because nothing's being done to the mechanism of their disease. It's being totally overlooked.
And that's how someone would normally be treated.
Absolutely, without any question.
How do you do things a little bit differently? What's the difference?
Well, really, in these types of patients, they're saying close to about 80% of these patients have Hashimoto. So what we do is we basically take everything we know about thyroid problems and we crumble it in our hands and we throw it in the trash because these patients don't have a thyroid problem. The thyroid is just a victim. They have an autoimmune disease that's attacking it. And so what we do is we do a bunch of extensive medical tests and in great detail and pinpoint what's causing it to flare up and destroy tissue. And this could be a numerous amount of things, but we go through and really customize a very personalized treatment plan for them to get better. And once we do that, these patients are seeing phenomenal results and seeing that their quality of life is a lot better than what it was before.
You mentioned results. What kind of results do you see from this?
To be honest with you, most of our patients, they have about 0 to 5 good days out of the month where they feel like they did before they had this disease. And so the results that we're seeing these patients are able to get their energy back, they're getting their quality of life back, they're able to lose weight finally. A lot of these patients, they could exercise till they drop dead and eat a 500-calorie diet and they'll still gain weight. So as far as that's concerned, we'll see about 20-25 good days out of the month. That's what we tell pretty much all of our patients. We just say more good days than bad days, but we're really changing their life. We're basically giving them their life back. So.
A significant turnaround. I know that there are people out there who think that might apply to me. How do they get a hold of you? You
can go into our website at utah-thyroidhelp.com, or you can call us for a free consultation at 801-446-2822.
Of course, Utah Thyroid Help is the website.
Yep.
We'll link you there from our website if you have more questions about that. Thanks for stopping in.
All right, thank you.
We'll go back to our Melanie Douglas and our 10-pound challenge when we come back on Studio 5.